In this lesson, I'm going to help you understand the different classifications for babies by their term and the risk associated for each. So there are two ways that babies can be classified. The classifications are either going to be time-based or weight-based. So let's look at time-based first. So we have preterm. Preterm is going to be those babies that are born before 37 weeks gestation. So premature. Then our term babies are born 37 to 42 weeks. So I actually did not know this until I started teaching. I thought it was 40 weeks. So make sure you know that 42 weeks. And then our post-dates babies are not until we are over 42 weeks. So 42 weeks plus. So those are our post-dates, post-term babies. Our weight-based kiddos. So these are going to be described as a large for gestational age or small for gestational age. And for short, we call these LGA and SGA. So our LGA babies are those that are over the 90th percentile. And this is just purely looking at their weight to their gestational age. Then we have small for gestational age, and these are going to be less than 10 percentile on the growth chart. So I don't want you to get confused. Our SGA babies is not to be confused with those that are low birth weight, extremely low birth weight, very low birth weight, any of that. These are just specifically going to be those that are small for their age. So for each of these, there's going to be some different assessment things that we're going to look at. So let's take a look at that. So first, our preterm babies. Remember, they are early. So the body is not ready to be born. So keep that in mind, and hopefully it'll help everything kind of click. So they are at an increased risk for infection because they are immature. Their immune system is immature, right? And then they are also going to be at risk for hypothermia, things like that, because of being so small or so early. Their bodies just are not ready to be born. They are at risk for hypoglycemia. So those are low blood sugars. They can't, because they can't provide warmth for themselves because they don't have the extra fat, they start burning up their blood sugar to keep warm. And they just don't have the extra glucose stores that term babies would have. So they don't have that. So they become hypoglycemic. Eating, they're going to have feeding difficulty. They get tired so easily, and they would rather sleep than eat. So tired out. So they have poor feeding. Jaundice, because that liver is going to be immature also because it is premature. And so the liver cannot break down this bilirubin as well. It builds up, and they get yellow, get that jaundice color. The integumentary system, you're going to see things on them like lanugo, which are those fine hairs. Now, those fine hairs are there to offer extra warmth for that baby. So it's actually a good thing that they're born with that. So you will see that. So the more lanugo you see on a baby, usually the earlier they are. You will also see some skin. You can kind of see more vascularity to the skin because the skin is more transparent. So you'll see that. You might also see more vernix on the baby, that white cheesy substance, because they are covered in that as a protective layer. So the more premature they have the more premature that they are, the more vernix that they have. Respiratory wise, so those lungs, they were not ready to be born yet, right? So you are going to see maybe some more signs of respiratory distress for these kids. They might need a little bit more assistance with breathing. Our post-term babies. So these are those ones, if you remember, that are 42 or more weeks. These kids are what we call overcooked. They were in the oven way too long, okay? So they've been in their past 40 weeks. The placenta, it's a fantastic organ, but it is meant to work for 40 weeks. So it starts to not work as well when we get beyond that. So it's just not meant to be permanent. So with this, the babies might show signs of having some weight loss. They might have weight loss prior to being born because that placenta is not giving them that constant nutrition through the placenta anymore. So they start to lose weight because they're not getting as much. Birth injuries, because typically they're bigger, right? So they get those broken clavicles, be shoulder dystocia at delivery because they're bigger. Meconium. So they're at risk for passing that first meconium, which is that first stool that they have, prior to being born, because they're 42 weeks. At this point, they should have been born and they would have had their first stool in a diaper, right? But they're not. They're inside, so their body might go ahead and pass that first meconium. So they're at risk for having meconium aspiration if that happens. So review the lesson on that for more information. Their integumentary system, you might notice longer nails on them. Their skin, this is the big one, is going to be really peely. So think about if you've ever in the water too long and your hands get all raisiny and peely. That's what happens. These babies have been overcooked in the water way too long, so they get peely and their skin's all wrinkly. And then hypoglycemia for these babies. They're at risk for that. And that's because they're bigger. They've already used up their extra stores and don't have that. And also if they're bigger, they're going to be using more sugar up and be at risk for hypoglycemia after birth. Okay, our SGA babies. So these babies are going to be at risk also for hypoglycemia and for thermoregulation. They are small. They don't have extra sugar stores that they would need. And then they have trouble thermoregulating because they're small. So again, with this, they don't have those extra stores, so they start burning up the sugar that they have to produce heat so that they stay warm. So that this just becomes a spiral effect where one starts to drop and then the other starts to drop. It's just a vicious cycle. Our LGA, our large for gestational age babies, these are at risk for trauma with delivery because they're big, right? They're trying to fit. Think about if you're trying to fit a tennis ball in a golf ball hole, it's not going to go well, right? So injury can happen because of that. Hypoglycemia. So these babies also at risk for hypoglycemia, just if they're bigger. So we'll be watching for symptoms of that. And then jaundice, because these babies might have more bruising from delivery because they're bigger. So trying to fit through this hole. So they get bruising. That's broken down red blood cells, and that is going to create jaundice. Our management will depend on the infant's gestation, their size, obviously hospital protocols, but I'm going to tell you some of the basic management pieces. So for our preterm baby, we want to give any respiratory support or assistance that they might need. These babies probably are going to need more frequent vital signs. That way we can catch a temp drop if it happens, prevent from getting worse, and provide good warmth for this baby. For our post-term baby, these kids are going to be watched for symptoms of hypoglycemia and treated if necessary. And then any respiratory support that's needed if they had any of that meconium aspiration. So we're just going to watch for that. Our SGA, these babies are going to need to be kept warm because they're small, and also monitor blood sugars for hypoglycemia. Our LGA infant will also have blood sugars checked and watched for hypoglycemia and then treated, of course, if they have it. And then birth injuries. If they have any birth trauma present, then we're going to check for that and care for it. We want to provide education to these parents. So first, they need to understand the importance of keeping their baby warm. Okay, that's always important. Help them understand the importance of things like skin to skin to provide that warmth, swaddling, hats, whatever it may be, just to keep them warm. We want to prevent hypoglycemia, so educating them on feeding. Make sure they're feeding enough to help prevent that hypoglycemia. If there are any birth injuries, then we will need to provide education for them on this. The most common is a broken clavicle, and these babies will need to be kept with their arms still. So I'll show you a picture here. I'm not the best artist. Okay, so on their little shirt, if this is the broken clavicle, so this side we let be free, this side we will safety pin the shirt arm to the shirt belly just to help keep that arm still so that clavicle can heal. Human development, glucose metabolism, and oxygenation are concepts because this all deals with the development, and we are very concerned with blood sugar and oxygenation on these kids. Okay, so what are our important facts? The preterm baby is going to be prior to 37 weeks gestation, and we are most concerned with respiratory, hypoglycemia, and thermoregulation. Our SGA, our term babies are 37 to 42 weeks gestation. Post-term is 42 weeks or more, and we're worried about hypoglycemia for them. Our SGA babies are under the 10th percentile, and we are worried about thermoregulation for them and hypoglycemia. And our LGAs are over the 90th percentile, and we're worried about hypoglycemia and any birth injuries for them. Make sure you check out the resources attached to this lesson, review the different ranges for the terminology and concerns that we have for each range. Now go out and be your best selves today, and as always, happy nursing.